The launch of the report today, I feel, is important because as a sufferer of HE, I want people to be aware of its existence.
Well, I think it's incredibly important. About 200,000 people in Europe suffer from hepatic encephalopathy, and yet many of those people are undertreated and they're underdiagnosed.
Public awareness and the awareness of politicians will raise. That's why I think it is really important. This is for the first time at the European scene that this kind of report is here in our hands.
The launch of this report today is vital for us to be able to get the proper care, treatment and support for everyone, not only with but also affected by hepatic encephalopathy. The report clearly outlines 10 key objectives that have got to be attained in order for anyone in Europe to get the best possible care and treatment for HE.
I would love to see a much greater understanding of HE by the medical profession, a much greater understanding of HE by the public, so that people who have HE can live a more normal life and have help in their suffering.
If you get the diagnosis, you have a liver disease, the doctor should really talk with you earlier over the problem HE.
As a patient myself, I would like to see less stigma. Then, of course, stigma will be less if the awareness is higher. This is very logical.
Well, I think there are three things really: awareness, getting rid of the stigma and working together. First, when it comes to awareness, we need to make sure that healthcare professionals and the public as a whole are much more aware of HE, as it's often shortened to. There's a big problem there that people don't know enough about the condition. But secondly, we also need to try and get rid of all the stigma. Sadly, advanced liver conditions, liver disease does have a stigma attached to it. It shouldn't have. We need to make sure governments focus on getting rid of that stigma. And finally, we need to act together. We need to get politicians like me to work with governments, with health professionals, with liver patients associations, so we can raise this issue up the agenda and get the treatment that HE patients deserve.